All right, let's dive into a pretty serious medical symptom and the surprisingly, well, elegant step-by-step plan doctors use to handle it. We're going to be talking about gross hematuria and the protocol for a situation that really leaves absolutely no room for error.
So, what exactly are we dealing with here? Gross hematuria isn't some subtle sign you need a lab to find. Nope, this is visible blood in the urine. And a lot of the time, it comes with clots, which tells any medical professional one thing, loud and clear: there's some significant bleeding happening and it needs to be dealt with right now. Okay, so imagine a patient comes in with this really alarming symptom. What's the plan? What does the doctor do? This is not the time for guesswork, right? You need a clear, proven playbook. The goal is simple: get the patient stable and figure out where that bleed is coming from. So, what's the very first move?
Your immediate response, the first line of attack, is to place a Foley catheter. This is step one. It's a direct action that's designed to get some immediate control over a pretty chaotic situation, and it serves a super crucial purpose right from the get-go.
So, why this first? Well, it's not just about draining urine. The catheter is basically doing two massive jobs at once. First, it gives you a clear path to drain those clots and stop a blockage from forming. And second, just emptying the bladder can actually help the bladder wall contract, which can sometimes slow down the bleeding all by itself. Okay, so the catheter's in. But what if that doesn't solve it? What if the urine is still bloody and clots just keep on forming? The situation still isn't stable. And this is where the protocol gets really smart. It has a built-in escalation plan for when step one just isn't enough.
The next stage is irrigation, basically actively flushing out the bladder. The first try is manual. A clinician will use a big syringe to push fluid in and pull it out, trying to break up those clots by hand. If that doesn't get the job done, you escalate again. You move on to continuous bladder irrigation, or CBI. This uses a special three-way catheter to create a constant automated flow of fluid.
You know, the logic here is actually super simple. Placing that Foley, that's like opening a blocked drain. The irrigation that comes next, well, that's like taking a hose and actively flushing that drain to clear out all the gunk. It's a powerful two-stage process designed to fix that immediate blockage.
So we've tried draining and we've tried flushing. But what if the bleeding is just too heavy? What if clots keep forming no matter what, even with continuous irrigation? For these really stubborn, persistent cases, the protocol has one definitive, final answer left.
When all else fails, it's time to go directly to the source of the problem. The definitive solution is a procedure called a cystoscopy with clot evacuation. We're not managing symptoms from the outside anymore. Now, we're going inside to fix the problem itself.
So what does that actually involve?
Well, a urologist takes a cystoscope, it's this thin tube with a camera on the end, and they insert it right into the bladder. This lets them literally see exactly where the bleeding is coming from. Then they can use instruments to physically go in and remove any clots that are left. It's the most direct way to both diagnose and treat the problem.
So let's just put it all together. The whole protocol, when you look at it, is this beautiful example of an escalating response. You start with the simplest, least invasive thing, the Foley. If that's not enough, you move to actively flushing with manual irrigation. Then you escalate to continuous irrigation. And only if the problem is still there do you move on to the final, definitive solution, the cystoscopy. See? Each step logically follows the failure of the one before it.
What we're really looking at here is a clear, reliable plan for a really chaotic and complex problem. It's a powerful reminder that in medicine, having a logical, stepped approach can be an absolute lifesaver. And that kind of leaves us with one final thought. What other medical emergencies, things like heart attacks or strokes, are managed with this same kind of elegant, escalating logic? It's a pretty powerful framework for thinking when you're under pressure.